guys, I just wanted to talk to you a little bit today about tongue ties and lip ties, also called ankylosing. This is something I'm very passionate about. Both of my children had both tongue ties and lip ties, and with Claire, my first, it was a very long and difficult journey because initially we didn't know what was going on. But eventually we were able to get her diagnosed, and she was actually treated when she was almost 9 weeks old. With Bennett, my second, we actually knew it was going on early on, so we were able to get it treated rather quickly. So I just wanted to give you guys a little bit of information so that you can actually advocate for your patients if you feel like there might be an issue. So what is a tongue tie? That is when we have a connective band of tissue that is restricting movement of either the tongue or the lip. There are 4 different types depending on the location or degree of restriction that's involved. So starting with lip ties, that's when you're going to see that connective tissue extending farther and farther down. With type 1, it's creating minor restriction and it's barely extending down, as to where with type 4, it's going to extend all the way down below the gum line and around and back to the palate. Now with lip ties, you're going to see, once again, 4 different classifications. Type 1 and type 2, those are the ones that you normally think about when you think of a tongue tie or lip tie. They're very visible even to the naked eye. They don't really involve any training to be able to diagnose them or to see them. So type 1 is going to extend all the way to the tip of the tongue. This is going to be the most restrictive of movement. It often creates that kind of heart-shaped tongue that you're thinking about when the baby's trying to lift. Second degree, there's a little bit more movement with the tongue. It doesn't extend quite as far back, but it's still fairly obvious. Types 3 and 4, those are going to be the ones that are going to be a little bit more difficult to diagnose. Those are underneath the mucosa. So unless you really know what you're looking for, if you've had special training, those are probably the only ways you're really going to be able to diagnose it. You may have a suspicion, but it's going to take a little bit of extra training to actually be able to look for it. Now, with symptoms, oftentimes you'll notice with mom, she's having a lot of issues with her nipple, whether she's having creasing or blanching with her nipples, if she's developing cracks or blisters, or she may even start bleeding. Also, you'll notice she'll have a lot of nipple pain when latching. You may feel like everything looks great from the outside, lips are flanged out, baby's getting a good deep latch, but mom is just complaining of a lot of pain. Also, once her milk comes in, she may notice that she's not fully emptying the breast because the baby is not physically able to actually empty the breast. Now with baby, you'll notice a couple different things. You'll notice that the baby may be pretty fussy all the time, is not wanting to latch very well, is kind of chewing at the breast with that latch, or you may notice there's a lot of crying at the breast, arching at the breast, pulling off frequently. You may also notice that this baby is unable to hold a pacifier in his or her mouth. Also, lastly, you may notice some clicking, a lot of noise when the baby's breastfeeding. So those are some reasons that we may want to look into a tongue tie a little bit farther. So what's going to happen if we don't fix this tongue tie? Well, of course, the short term that we think about is going to be breastfeeding difficulties. Oftentimes, these moms will actually give up on breastfeeding because it's just too painful, it's not working out, baby's not, having an easy time at the breast. So a lot of times you can see these moms give up. But later on in life, if we have these tongue ties or even lip ties that are not fixed, they can actually cause issues later in life, such as speech impediment. I don't know if you guys have seen on the news, Dr. Amy Ludeman, who actually treated my son, has gotten much coverage for the fact that she treated a boy that was unable to talk. He had severe speech impediment, and so she actually improved his life with this. So an amazing thing. But also you may notice that a person may experience such things as snoring, severe indigestion, or let's just talk about the simple ones. person's unable to lick an ice cream cone because they can't stick their tongue out, or the fun one that we don't really like to talk about but we think about, French kissing. So what are we going to do if we suspect that a baby has a tongue tie or lip tie? We are going to refer them out. Of course, we cannot make an official diagnosis, so we're going to refer them out. Both Cartar and Anne have information on referring them out to different ENTs or dentists. So if you suspect that a baby may have a tongue tie or a lip tie, just ask Anne or Cartar for some of that information and they'll be able to get some paperwork for you. But we're going to refer out to an ENT or a pediatric dentist. The ENT is going to use scissors for clipping. Now, a pediatric dentist will use what's called a water laser. That is going to release that tie, and dentists have to be specially trained for this. You can't just send them to any dentist. So we will refer them out to ones that we know are specially trained for that. Now, after they have it done, just so you know, there will be exercises that they'll want to do so that that tie does not re-adhere. Because then if it re-adheres, of course, they would have to revise it again. So usually with results, many moms will see improvement within 24 hours, but it can take up to 3 months to actually see full improvement. So I know a lot of times we aren't going to see the full effects of this in the hospital, but if you do notice that a baby may have an issue, it's best to just go ahead and tell the mom, hey, there may be these potential issues. If you notice these different signs and symptoms, then it wouldn't hurt to get it checked out. So just go ahead. If you feel like there might be an issue, don't hesitate to tell mom, because it may save her a lot of pain, a lot of time, and a lot of trouble, and it may very well save that breastfeeding relationship. So if you have any questions, just refer to Anne or Cartar, or a lot of us are actually starting to get more experience with this, so definitely refer to us if you have any questions. And I know Anne's going to discuss this a little bit more a little bit later. Thanks, guys.